Here we go.
Hello again, and thank you for viewing the second part of our HIV information. I am Tina Murphy, the Director of Health Action Charity Organization, HACO. HACO works with African communities on HIV-related issues in Medway. We are involved in prevention and support. In our last video, we talked about the statistics of HIV globally and locally in Medway. But now, what does letter HIV stand for? HIV stands for Human Immunodeficiency Virus. And HIV leads to AIDS. AIDS is acquired immune deficiency syndrome. Now, some people say, oh, somebody died of AIDS. Nobody actually died of AIDS or HIV. People die of AIDS-related illnesses. I will talk more about this in our next video. Now, how do you contract HIV? There are three main ways by which HIV can be contracted. Through unprotected sex with somebody that has HIV, through sharing of needles by those that take drugs, through blood transfusion, though it doesn't really happen in the UK because blood are screened before the blood is transfused to another person that needs the blood. Then the fourth one is through mother to baby. But lucky enough, with the medication, 90% of the babies in developed worlds are born without HIV. Now, what happens in the body of somebody who is infected by HIV? A simple explanation I normally give about this is when there is a coup in a town, the occupying force go to the radio station, capture the broadcaster, and make them broadcast what they, the occupying force, want the people in the community to hear. It's the same thing. HIV attacks the body, destroys the immune system, and the body starts producing antibodies to fight away the HIV virus. Now, there are few people who don't really know how HIV is transmitted. And this, therefore, leads to stigma. I want to make the point clear today through this video and give you ways that HIV cannot be transmitted. This might reduce stigma, and this stigma is preventing people from testing, preventing people from telling their loved ones that they are HIV positive, preventing people from seeking help and support which they need at the point of diagnosis. Now, you cannot get HIV through kissing, touching, hugging, or shaking hands. You cannot get HIV from sharing a cup or cutlery with a person that is HIV positive. When somebody that is HIV positive coughs or sneezes, you cannot get HIV from that. Some people say, oh, somebody that is HIV positive, they go to the toilet. Oh, I'm not going to that toilet again. You don't get HIV from sitting on a seat that has been, the toilet seat that has been used by somebody with HIV. Some people said through insects and animal bites, which is completely not true. From swimming pool, you cannot get HIV from the swimming pool. Then eating food prepared by somebody with HIV, no, you will never get HIV from food that has been prepared by somebody that is living with HIV. Now, thank you again for watching this video. I'm going to leave you with this information, and in part 3 I'm going to give you more information about HIV, and I'm going to stress on how we are going to try and minimize the stigma that surrounds HIV and the people living with the virus. Thank you.